Hey everyone, and welcome to a deep dive into something pretty fascinating and honestly mind-bending too, using psychedelics to treat depression. We're going to be looking specifically at the science of it all, especially compared to like those traditional antidepressants. We've got a whole bunch of research articles, some abstracts, and even some insights from experts, from different videos, all ready to go.
What's really interesting, I think, is we're not just looking at whether these things work, but like how they work on this biological level, maybe even rewiring the brain. So we're going to dive into some complex things like 5-HT2A receptors, neuroplasticity, but we're going to make sure it makes sense.
Definitely.
Plus, we'll talk about setting that whole idea. It's super important for any psychedelic experience. And we'll even explore like their potential for end-of-life care.
Yeah, for sure. Okay, so to set the stage, let's talk about why people are even interested in psychedelics these days.
Yeah.
You might think it's all about having a psychedelic experience, right? But a study with over 1,000 Spanish-speaking participants found something that I think is kind of surprising.
Yeah.
The top reason for using psychedelics wasn't, just for kicks. It was actually for self-knowledge.
Yeah, it really challenges the stereotype, doesn't it? It suggests that people are drawn to this potential for inner exploration, psychedelics could be a tool for personal growth. And this ties into the growing interest in psychedelic therapy too.
For sure.
That same study found that people who'd already used psychedelics for their own personal exploration were more open to trying them therapeutically.
That's so interesting. It makes you wonder if those personal experiences kind of create a foundation for healing.
Yeah.
Like in a therapeutic setting. So now let's shift gears to a specific psychedelic, MDMA. Most people know it as, a party drug. But recent research, especially studies sponsored by MAPS, the Multidisciplinary Association for Psychedelic Studies, has shown its potential in treating PTSD. And PTSD can be incredibly debilitating.
Yeah, and the results are really remarkable. People who were receiving MDMA-assisted psychotherapy showed a much bigger drop in those PTSD symptoms compared to those getting a placebo. So this really suggests that MDMA could be a powerful tool for healing trauma in a therapeutic context.
For sure. So what's actually happening in the brain? I mean, how does MDMA work on a biological level?
Well, MDMA is what we call a triple monoamine reuptake inhibitor. That means it boosts the levels of serotonin, norepinephrine, and dopamine in the brain. Think of them like your brain's mood regulator.
So it's influencing multiple mood chemicals at once.
Exactly, yeah. And that's actually a key difference compared to traditional antidepressants, which often target just one neurotransmitter.
Okay.
So that could be why MDMA seems to have faster and potentially more profound effects, at least in the context of therapy.
That's really interesting. So it's MDMA is hitting the mood system from multiple angles. Now, let's talk about another psychedelic that's getting a lot of attention.
Yeah.
Psilocybin, the active compound in magic mushrooms.
Right. So psilocybin primarily works its magic, so to speak, through serotonin receptors in the brain, and specifically the 5-HT2A receptor subtype.
Okay, so we're talking about receptors now. For those of us who haven't taken a biology class in a while, can you break down what that actually means?
Sure. So imagine receptors as these tiny little docking stations on your brain cells. When a molecule like psilocybin comes along and it docks at the 5-HT2A receptor, it triggers a cascade of effects within the cell, and that can lead to the changes in perception and mood that people experience.
So it's psilocybin is flipping a switch in the brain, specifically at this 5-HT2A receptor.
Precisely. Yeah, and we know this is key because, studies have shown that if you block this receptor with a drug called ketanserin, it actually diminishes those psychological effects of psilocybin, feelings of happiness and changes in emotional processing.
So blocking that specific receptor is like turning down the volume on the psilocybin experience.
You could say that. It highlights just how important this particular receptor is in mediating the effects of psilocybin.
Okay, so we're talking about receptors, neurotransmitters. Things are getting pretty complex here.
Yeah.
Let's try to zoom out and visualize how psychedelics actually affect the brain as a whole. We know they impact brain connectivity, especially in a region called the thalamus, which acts as a filter for information.
Right. You can think of the thalamus like a gatekeeper for the senses.
Okay.
It's kind of deciding what sensory information gets through to the cortex, the outer layer of the brain, where all that higher level thinking is happening. And psychedelics seem to disrupt this filtering process, and that leads to an overwhelming flood of sensory information.
Wow. So it's suddenly experiencing the world without a filter.
Yeah.
That could explain why people report such profound changes in perception and awareness.
Exactly. And it's not just about the external senses. Psychedelics also impact the way that our brains process, like our internal world, our sense of self.
So I've heard about the default mode network. Is that what you're talking about?
Yeah, the default mode network is this network of brain regions that's active when we're daydreaming, self-reflecting, basically when our minds are wandering. And the popular theory is that psychedelics disrupt this network, and that leads to less rigid thinking and opens up new perspectives.
So it's like shaking up our ingrained thought patterns, those default ways of seeing the world and ourselves.
That's the idea. However, it's important to note that psychedelics don't just affect that default mode network. Research shows they impact connectivity across the entire brain, so it suggests a much more complex, and widespread effect.
So it's not just about turning off one part of the brain. It's more like rewiring the whole system, a whole brain transformation. That's pretty mind-blowing.
It is, and that's one of the reasons why researching psychedelics is so exciting. We're starting to kind of unravel those complex ways that these substances interact with the brain, and it could lead to new ways of understanding and treating mental health conditions.
This is where it gets really interesting. How does all of this brain rewiring, this altered connectivity, translate into actually treating depression?
Well, one key mechanism being explored is something called 5-HT2A-mediated neuroplasticity.
Okay, break that down for me. What in the world does that mean?
Essentially, it means that psychedelics, by acting on those 5-HT2A receptors, can promote the growth and adaptability of brain cells. So think of it like fertilizing the brain, helping those neural connections grow stronger and more flexible.
Okay.
And this enhanced neuroplasticity could be key to rewiring those pathways that are involved in mood regulation, breaking free from those really stuck patterns that contribute to depression.
So it's like psychedelics are giving the brain the tools to rewire itself, to create new, healthier pathways.
Exactly. And this is where BDNF comes in. BDNF stands for brain-derived neurotrophic factor. It's basically a protein that acts like fertilizer for the brain, helping neurons grow and thrive.
BDNF, the brain's fertilizer. I like that.
Studies suggest that psychedelics might increase those BDNF levels, and that could play a major role in their antidepressant effects. More BDNF means a healthier and more adaptable brain.
That makes sense. So we have this enhanced neuroplasticity, more BDNF. Are there any other mechanisms at play here?
Yes. There's also the activation of AMPA receptors, which are involved in communication between brain cells.
Okay.
Changes in AMPA receptor function might enhance something called synaptic plasticity, basically making the brain more adaptable to change.
So it's like psychedelics are hitting the brain's reset button, allowing it to become more flexible and responsive.
That's a great analogy. And what makes this research so promising is that psychedelics seem to be tackling depression from multiple angles, unlike traditional antidepressants that often just focus on one neurotransmitter system.
It's like a multi-pronged approach to rewiring the brain and lifting the fog of depression.
Yeah.
Before we move on, I want to touch on a sensitive but important topic, end-of-life care. I know there's some early research on using psychedelics, specifically LSD, to help people cope with the emotional distress that often comes with facing death.
Yes, there was some fascinating research in the 1960s looking at LSD-assisted therapy for people with terminal cancer.
Wow.
And the findings were really intriguing. Patients reported feeling less anxious and fearful about death, and some even experienced a profound sense of peace and acceptance.
That's incredible. To face your final days with less fear and more peace, that's a powerful testament to the potential of psychedelics to help us navigate life's toughest challenges.
Absolutely. And while more research is certainly needed, these early findings suggest that psychedelics could play a valuable role in palliative care, helping people find comfort and meaning in the face of death.
Yeah, it's definitely an area that deserves more attention and exploration for sure. We've covered a lot of ground in this first part of our deep dive. We've explored how psychedelics differ from traditional antidepressants, not just in their effects, but in the way that they interact with the brain, on this fundamental level. It seems like they're offering this whole new paradigm for understanding and treating depression.
Yeah, and we've only just scratched the surface. In the next part of our deep dive, we'll delve deeper into the research, exploring the specific studies that are shedding light on the therapeutic potential of psychedelics. We'll also discuss some of the challenges and considerations that come with this type of therapy.
Stay tuned for part 2 of this deep dive, where we'll continue to unravel the mysteries and possibilities of psychedelics in the treatment of depression.
Welcome back. It's time to dive even deeper into this world of psychedelics and their potential for treating depression.
So we left off talking about some really promising mechanisms of action like neuroplasticity and BDNF, that brain fertilizer that seems to get a boost from psychedelics. But let's get into the actual research because, as they say, the proof is in the pudding.
Absolutely. One study that really stands out is the research on psilocybin for treatment-resistant depression.
Okay.
This is a particularly challenging form of depression where traditional antidepressants just haven't been effective.
So we're talking about people who have tried like multiple treatments, maybe for years, and still haven't found relief. The need for new approaches is like huge.
Exactly, yeah. In this study, participants received 2 doses of psilocybin a few weeks apart, and that was combined with psychotherapy.
Okay.
And the results were honestly pretty impressive. 5 weeks after that second dose, a significant number of participants showed a major reduction in their depressive symptoms.
Wow, that's got to be like a beacon of hope for those folks who've been struggling for so long. But it's not just about the immediate effects, right?
Yeah.
What about long-term relief?
That's the big question. And the encouraging news is that a lot of those participants continued to experience those improvements in their depression, even months after the psilocybin sessions.
So it wasn't just like a temporary mood boost.
Right.
It suggests that psilocybin, in conjunction with therapy, might offer like a more lasting change.
Precisely. It hints at the potential for long-term shifts in brain function and mood regulation, something that traditional antidepressants often struggle to achieve.
For sure. Now, another area where psychedelics are showing some promise is in treating addiction.
Yeah, that might seem a little counterintuitive given that, psychedelics themselves can be seen as like drugs of abuse.
Oh.
But research suggests that substances like psilocybin and ayahuasca may actually help people overcome addiction to things like alcohol, nicotine, even opioids.
Wow, it's almost like rewiring the brain's reward system, breaking free from those like deeply ingrained addictive patterns. How does that work exactly?
Well, it seems that psychedelics may increase the levels of a neurotransmitter called glutamate in the prefrontal cortex. That's that part of the brain involved in decision-making and impulse control.
So it's like giving the prefrontal cortex like a boost, helping it regain control over those addictive urges that can feel so overwhelming.
Exactly. And this brings us back to the crucial role of set and setting that we talked about earlier. Remember, set refers to the individual's mindset going into that experience, their expectations and intentions. And setting encompasses the physical and social environment where that experience is taking place.
Right, so like having those trained therapists present, using calming music and visuals, creating like a space where people feel safe and supported to like really explore their inner world.
Precisely, yeah. In a therapeutic setting, that set and setting is carefully, curated to maximize the chances of a positive and healing experience. And this is really important because psychedelics can also have those challenging effects. It's something we need to acknowledge.
Of course, it's not all like sunshine and rainbows. Like any therapy, there are potential risks.
Yeah.
And it's not like this one-size-fits-all solution. What are some of the things that people should be aware of?
Well, one concern is the potential for those challenging psychological experiences, like during a psychedelic session. Some people might experience, anxiety, paranoia, or even like a temporary worsening of those depressive symptoms.
That sounds pretty intense. It really underscores why it's so crucial that these therapies are conducted in like really controlled settings with those trained professionals who can help people, navigate those difficult moments.
Absolutely. It's also important to note that psychedelics can interact with certain medications, and they might not be suitable for everyone, especially individuals with pre-existing mental health conditions like psychosis.
So it's not a magic bullet, and there are definitely risks to consider. But those potential benefits are so compelling, especially for people who haven't found relief with those more traditional treatments. It feels like we're on the cusp of like a real paradigm shift in mental health care.
I agree. The research is moving fast, and it's really exciting to see those possibilities unfolding.
So where do we go from here? What are like the next steps in this psychedelic revolution?
Well, ongoing research is absolutely crucial. We need those larger, more rigorous clinical trials to solidify that evidence base and refine those treatment protocols. We also need to better understand the long-term effects of psychedelic therapy and ensure the safety and well-being of participants.
And let's not forget about access. Right now, that legal status of psychedelics is a major hurdle in a lot of parts of the world.
Definitely. Addressing those legal and ethical considerations is essential, to ensure equitable access to treatment, protect vulnerable individuals, and foster that responsible use.
It's a complex landscape, but the potential of psychedelics to alleviate suffering and expand human consciousness is undeniable.
This deep dive has given us a glimpse into, the science, the promise, and the challenges of using psychedelics to treat depression.
And the story is still being written.
Exactly. Stay tuned for part 3, where we're going to explore that therapeutic process itself, and we'll consider what the future holds for this, rapidly evolving field.
Welcome back to the final part of our deep dive into psychedelics and depression.
We've, dug into the science, the potential benefits, and we even touched on some of the challenges too.
Right.
So now let's kind of shift gears and talk about what psychedelic therapy actually looks like the process itself.
Yeah, it's one thing to, understand how these substances work in the brain, but I'm really curious about the human side of things, the experience of actually going through this type of therapy.
Yeah, it's definitely not like taking a pill every day.
Yeah.
Psychedelic therapy is, much more interactive and experiential, a real journey.
So it's not just about the drug itself, it's about how that whole psychedelic experience is integrated into this therapeutic framework.
Exactly. And preparation is key. Even before that psychedelic session even happens, individuals typically undergo several therapy sessions to build that trust with the therapist, set some really clear intentions for the experience, and, work through any fears or concerns they might have.
So it's like laying the groundwork for a safe and meaningful exploration, making sure that everyone is on the same page.
Precisely. And then during that actual psychedelic session, the therapist's role is to really provide that support and guidance, helping the individual kind of navigate those often intense and really profound experiences that can arise.
Because let's be real, these experiences can be pretty wild.
Right.
People are having these profound shifts in perception, feeling deeply connected to the universe, confronting their deepest fears.
Absolutely. So the therapist might use techniques like mindfulness, breath work, emotional processing to help that individual make sense of those insights and emotions and kind of ground them in the present moment.
So it's about holding space for whatever comes up, good or bad, and helping the individual really integrate those experiences into their understanding of themselves.
Exactly. And that integration, doesn't end with that session. Afterwards, individuals continue therapy to process the experience, connect it to their daily life, and develop those coping strategies to deal with challenges.
It's like weaving those threads of that psychedelic experience, into the tapestry of their life, making it like a source of strength and growth rather than just something that's compartmentalized.
Right. Now, another really fascinating aspect of psychedelic therapy is its potential for spiritual growth and personal transformation.
Yeah, this is what really intrigues me. I've heard so many accounts of people having these profound mystical experiences, feeling this deep sense of interconnectedness, awe, and just a completely different understanding of themselves and the universe.
Yeah, those experiences can be incredibly meaningful and can lead to those lasting changes in values, beliefs, even behavior.
It's like a spiritual awakening, a shift in perspective that ripples out into every area of life.
Of course, it's important to note that not everyone has these kinds of mystical experiences, and they're not necessary for the therapeutic benefit.
Right. It's not about chasing some sort of spiritual high.
But they do highlight the potential for psychedelics to, facilitate that personal growth and a deeper sense of meaning and purpose. And that can be incredibly healing, especially for those struggling with depression.
Absolutely. It's these experiences can help people, reconnect with something bigger than themselves, find a sense of belonging and purpose that might have been lost along the way.
As with everything we've discussed, it's really important to remember that psychedelic therapy is still in those early stages. There's so much more research to be done.
Right. We're just beginning to scratch the surface of what's possible.
We need to understand those long-term effects, refine the treatment protocols, and, make sure these therapies are safe and accessible for everyone who could benefit.
And we need to do it responsibly.
Right.
Addressing those ethical considerations, making sure that vulnerable individuals are protected.
Absolutely. But despite the challenges, that growing body of research really suggests that psychedelics used responsibly and in conjunction with therapy hold this immense potential for transforming mental health care.
It's like we're rediscovering these ancient tools, these powerful substances that have been used for healing and spiritual exploration for centuries. And now we're integrating them into this modern therapeutic framework.
It's a real paradigm shift, a re-examination of our relationship with these substances and their potential to heal, to inspire, to expand our understanding of consciousness itself.
This deep dive has been a fascinating journey.
Yeah.
And it's clear that the story of, psychedelics and mental health is really just beginning.
We encourage you to keep exploring this field, to stay informed about the latest developments, and to approach this topic with curiosity and an open mind.
Thank you so much for joining us on this deep dive into this world of psychedelics and depression. We hope you found it informative and thought-provoking.